Welcome, Tulane parents, to our Campus Health parent webinar this evening. My name is Penny Wyatt, and I'm the Director of Parent Programs and External Relations for the Division of Student Affairs, and we're very happy to have you here with us this evening. I want to give you a couple of tips about how we handle our webinars. This is the first one of this season for new parents especially. So let me tell you what we usually do. So we ask that you hold your questions until the end. We've tried to anticipate your questions, and we try to refine our presentations based on last year's questions every year. But you will have a chance to submit questions by typing them in. So you have a dashboard on your side. You are not mic'd, so you would be able to type those in, and we'll give you a cue when it's time to start typing in questions. And if we don't get to all the questions, we'll catch up with you by email later. The other thing that we always do is send everyone who registered. On the next day, I'll send you an email message that will contain a link to the recording in case you want to hear it again, and also a PDF of all the slides. So you don't really need to worry tonight about trying to take notes on what you see on the slides, because you'll get this tomorrow. And then eventually, in a couple of days, it'll be on our website at parents.tulane.edu under the Communication with Parents tab. You'll find our webinar schedule and our webinar archive. So before we get started, just to kind of check that everything's working, I would ask that if you can hear me okay, then use the little raise your hand function on your control panel and raise your hand. That gives me an idea that yes, you can hear. So I see some hands raised, so I'm figuring that that's working okay. I will tell you that this is the volume we'll be using, but if you need to increase the volume, you can do that on your side, so you can make that adjustment. Also, sometimes we've had people who lost their Wi-Fi connection or something in the middle. You can also phone in. So that email message that you received about the confirming that your registration would also give you instructions for that. So we'll get started, and I'm really happy to introduce to you my colleague, Dr. Scott Timms, who is our Assistant Vice President for Student Affairs for Campus Health, and so he'll kick us off. Thank you.
Thank you, Penny. I'm excited to get to talk to you all today a little bit about what Campus Health is and the services that we're able to provide to help support your student be successful during their time at Tulane. I'm joined by my colleagues, Dr. Ann Ciccone, a clinical psychologist from CAPS for Counseling Services, and our medical director from the Health Center for Student Care, Dr. Daniel Garrett, who will also be, both of them will be talking to you very specifically about the services at those two units. Again, we're very excited to talk with you. Our contact information will be available through the webinar, so you can always reach out and ask any individual questions that you might have as a follow-up. So, you know, it's exciting for us as a campus health unit because we work very closely with our students. We have a variety of programs and services to meet the needs, ranging from our health promotion office to our counseling center and health center. So we're very lucky at Tulane to be able to provide you with a wide variety of services there. We really enjoy being partners with parents, and so we look at our relationship with you as being integral to the success of your student. So we want to be their primary healthcare provider, and we want you to be our partner in that. We know that oftentimes parents, I think, are struggling with the idea that their student is going to the doctor or to a counselor or therapist for the first time without you being there. We understand that, and again, we see you as a partner in this transition for your students. So we look forward to working with you and being able to help you support your student in the transition. So today I'm going to talk to you about health, wellness, and academic success and things that we know about students and the way we approach things. You'll hear about each of our specific departments, the WELL, CAPS, and the Health Center. We'll also talk to you a little bit about insurance and our fees for service, and we'll also review a new student checklist just so you'll know all the different things that need to be completed for your student before they arrive. Our website here has just been redesigned, so please check it out, campushealth.tulane.edu. This is a great resource that will have information and more details about everything that we'll talk to you about today. This website also has under especially for a section just for parents, so please check that out. We provide you resources on after-hours care, local pharmacies that deliver to campus, urgent cares that we recommend, anything like that for a parent that you need. It also has information about immunizations and insurance that are things that are very important for you to know and for your student to be able to access. So again, check that out. The website just went live last week, so if you find a broken link, feel free to let us know and we'll take care of that. So as your students are coming, one of the things I always like to talk about are the things that students tell us are their top academic impediments to their success. So cold, flu, sore throat, sleep difficulties, anxiety, and stress. So when we talk about our first year students on the data that we collect from them on our National College Health Assessment, this is what we hear really are causing them issues when they get here. It's not a huge surprise, and I can tell you this is very similar to that data that we see nationally. We've seen an increase in mental health struggles among our students. We've seen an increase in physical health issues. And over the last 10 to 15 years, the severity of those issues has grown. And as a health unit on campus, we've been trying to grow and adapt to meet the needs of those students. So these are all things that we're aware of. You need to be aware of and start having conversations with your students now so that you can help them have a plan for how they're going to deal with that when they get here. I'm a public health professional by training, so I always want to do a plug for make sure they get that flu shot. We'll do a free week of flu shots this fall. Very important because a cold or a flu or any kind of an illness very early in their time here can really derail that first semester and make it difficult. And the weather in New Orleans is a little bit different than anywhere else, so make sure that that happens. The Well for Health promotion is our prevention arm. It serves as the public health outreach arm of campus health and provides a variety of services to students to help keep them happy, healthy, and safe while they're here. It's staffed by health education specialists, which are all certified in the work that they do. They have master's level public health and social work and higher education. And so these are the staff that are really out making sure that your students have the skills and the knowledge to be successful here. We focus on population level prevention and do a variety of programs. If you are here for summer orientation or if they're during move-in weekend, they'll be hearing from these folks about how they can be successful here at Tulane, and they provide a variety of online resources. They will also be putting out some pre-matriculation services or online education for your students in the coming weeks. We look at, through the Well, how we engage students in their work to help them create a healthier campus. We help build individual capacity, so we work through the Well to help students figure out ways to be more successful while they're here. We teach them to be advocates for themselves. We want them to understand how to access the resources, how to really come in and talk to a healthcare provider. The Well has several content areas that they focus on, substance abuse prevention being a major part of that. Sexual health education. We also talk to them about well-being, prevention, not treatment. And so, you know, a good example of that is we really talk to students about when they're planning out their schedule, not to just in their calendar put the times that they have tests or the times that they need to study, but also putting in there times that they need to take care of themselves, times to go to the gym, time to talk to family, time to talk to their friends back home. The Well also focuses on violence prevention, and that can be anything from how to stay safe during Mardi Gras to talking about discussions about sexual violence. So again, the Well provides a real core service to help students address a variety of health issues. Again, there are a variety of workshops that we provide through our health promotion office, including our TOUGH program, which helps mentor future health professionals. We work with a variety of undergraduate public health as well as pre-med students. We have an e-health promotion page through our health promotion office where a variety of online tools and resources are there. We also have some resources just for parents on how to have conversations with their student about certain health topics. We have a guide for how to have a discussion with your student about alcohol, and I encourage you to check that out. The TOUGH program are the Tulane University Peer Health Educators or Certified Peer Health Educators. The purpose of this program is to have students who are out providing advocacy and facilitating healthy lifestyle choices, personal safety, and personal well-being among students. We have a large group of students who we train to go out and provide education in our residence halls. They provide outreach in a variety of settings, and they do that because those are places where I can't go as a pro staff anymore. I'm a little bit too old to do that, but students like to hear from other students. They like to talk to each other. This is a great leadership opportunity for a student who's looking for a way to get involved and to give back on campus. So again, if you've got a student who's interested in public health or in a pre-med or some sort of a health-related field, this is a great way for them to gain practical experience in working with our students. So I'm going to turn it over now. I'll talk to you guys again a little bit later, but I'm going to turn it over to Dr. Ann Ciccone, who will talk to you about CAPS for counseling services.
Thanks, Scott. Again, my name is Ann, and I'm the Assistant Director for Clinical Services at CAPS and also a clinical psychologist there. CAPS has a lot of different disciplines working together. We have licensed clinical social workers, licensed professional counselors, and psychologists, all who offer therapy, and we also have psychiatrists who prescribe medication. We have multiple locations across the Uptown and Downtown campuses, the main one being Building 14 on the Academic Quad, which is the engineering and science lab on the first floor. That's where most of our therapists are housed and where most students will find or make their first appointment. Also uptown we have our medication prescribers, so psychiatrists and our medical psychologists located at Building 92, which is the health center uptown, and they're located on the 3rd floor. Additionally, we have a CAPS location downtown. This location mostly serves graduate students, but in case that's ever more convenient, your student can also request an appointment down there. To come to CAPS, you'll want to call the number listed here on the screen, 504-314-2277, or stop into Building 14 or the downtown location to schedule an initial consultation appointment. If your student knows or your child knows what service you're seeking specifically, please let us know. Sometimes you know that you want only therapy services or only medication, or one of the groups appeals to you primarily. If you know that one of these services speaks to you solely or to your student, please request that because we can fast track these requests a little faster. If you're unsure, it's also okay. Just call and make an appointment and we can discuss any options that are available. An important service we have at CAPS that I want all of you to really pay attention to is care coordination. We have a care coordinator on staff, Paige Barbe, who's a licensed clinical social worker who dedicates a significant amount of her time placing students in the community. So with psychiatrists and therapists who we have recognized in the area around campus. There are many reasons why some students want to go to the community or are better served. Sometimes, like the first bullet says, they're just better served by ongoing treatment. A lot of times you've already identified an ongoing need where therapy has historically helped or medication has historically helped the student get through some rockier times. If that is known, then sometimes establishing one provider prior to them getting here to campus can be an awesome benefit for the transition and can be someone that they can return to over their 4 years here. Another reason a student might use care coordination services is if they've used short-term services at CAPS and they want to continue. So they found benefit and want a secure connection in the community for ongoing services. And some students just want to go off campus. They'd prefer to not go to CAPS and just be seen off campus. So we can help throughout their time, their 4 years at Tulane. If you would like to talk to Paige more about any of the options available in the community, please do so. Her phone number, her direct line is listed there as well as her email, and she's expecting parents to reach out. So please feel free. She is happy to answer any questions. If your child comes to CAPS for the first appointment, it's going to be a consultation. That appointment's typically about 20 or 30 minutes, and the student will kind of talk about broadly what's going on, and the therapist or provider who's meeting with your student will kind of discuss, what's going on, let them know a little bit about therapy or the other services provided, and collaborate together on making a plan that makes most sense. There are many recommendations that can result out of that consultation. One could be that a CAPS group would be beneficial. These, a lot of students kind of balk at group at first blush, but it's been found to be a really powerful intervention to come together with other peers who have similar concerns, to help each other and to, not feel alone in whatever presenting concern is coming up. The student may be encouraged to initiate short-term therapy at CAPS, or receive a medication evaluation and prescription through one of the psychiatrists or medication prescribers. Again, we might connect them with Paige, the care coordinator, if community seems like a good option. And of course, there's tons of other campus services that will offer as they seem relevant. Their Success Center, for example, helps with things like studying and time management or academic advising if there's a question about course load or any problems related to academics that could be practically solved. We have a good roster of groups lined up for this fall, the top one listed here being possibly of primary focus for the parents listening. That's the freshman transition group. A lot of students, no matter their excitement, face challenges in this big transition to sometimes a different city, definitely a different culture at the Tulane campus, and trying to figure out, how to set up their own routines, how to find a friend group, who they are in this big jump from home to a more independent life on college campus. So again, if you feel like that would be of most help, request that when you call, because we can maybe get you there a little faster. These other groups might also, of course, be of interest. There's Life at Tulane, which kind of touches broad areas of concern, such as academic stress, identity concerns, problems maybe faced with peers or roommates, that sort of thing. If there's any body image concerns, we have a group for that, and a group dedicated to women of color. We also have one titled Break the Silence, which is for anybody who has dealt with sexual assault. We have a grief and loss group, and we also have a group for those who are coping with a serious physical illness. If individual therapy is deemed appropriate for your child and short-term work seems appropriate, then they'll stay on with a therapist at CAPS and attend up to 12 sessions per academic year. Of course, there's also Paige, again, who can help people get to the community, which is more open-ended in terms of duration. But it's important to note that when we run the numbers, students on average attend about 6 sessions. So although there is this cap of 12, the whole time we're looking at what's being needed, what's needed, what progress is being made, and kind of tailor it based on that more than strictly on the sessions allotted. If beginning a new medication is indicated, we have a psychiatry team who we can schedule your student with for a medication evaluation. The services here, again, are based on stabilization and are more short-term focused. So once someone is stabilized on any kind of medication regimen, they will be connected to any provider for ongoing treatment, more maintenance stuff. Please remind your student that we always have someone available through the line. It's a 24/7 crisis hotline. This can be utilized any day or night. So if they don't want to come to CAPS to talk to someone, for example, or if it's 2 a.m. and some concern is really on their mind, please encourage them to use this resource. It's what we have it for. It's confidential and staffed by trained support specialists, and they know the Tulane resources, so can help get them where they need to go. The big plug here for all parents listening is that if you know your student has any ongoing needs, mental health needs, concerns, if therapy has been useful up to now, or if there's any sort of medications that seem to really help them be successful, we really encourage you to reach out to Paige to find out who in the community might be a good fit. She really tries to tailor needs. So, you know, in terms of insurance, in terms of proximity or any other kind of request, she really works hard to make sure people can get placed, and this can happen in the summer. So before your student even arrives, they can have an appointment already placed with someone who can be kind of a warm handoff in the community. Some providers too, I'll say this, will do therapy from the home location or keep prescribing from, you know, their location, and that can also be great for continuity of care. But just to plan ahead, you know, the transition, like I said before, is exciting, but also has its challenges and can get lost in the weeds with all the other stuff going on. So the sooner you can act to set something up in the community, the better, and Paige or any of us at the Counseling Center are there happy to help. I think that's it for CAP, so I'm going to pass it on to Dr. Daniel Garrett.
Thank you, Ann. Hi, this is Dr. Daniel Garrett. I'm the Medical Director for the Health Centers for Student Care. And I will be giving you an overview of who we are and what services that we provide. So we have two locations as well. We have our Uptown location, which is in Building 92 on the corner of Newcomb and Willow Street. We also have our downtown location, which is located in 127 Elks Place, room 261. At our Uptown campus, we have board-certified physicians, family nurse practitioners, a mixture of registered nurses and licensed practical nurses. We also have a registered dietitian on staff, and our staff has multiple years of college health experience and knowledge. At our Uptown Clinic, we have a primary care floor, primary care clinic. We have a preventive health clinic, and I'll speak more about both of those clinics here in a moment. We also have a laboratory where we can do point of care testing, such as strep tests, mono tests, and flu tests. We will also provide phlebotomy or blood draw services. We will honor orders from outside providers and fax those results to that provider for their review. And we also have a pharmacy on site. And again, I'll speak about that a little bit more later. Within our primary care clinic, we manage chronic and acute illnesses. So an example of a chronic illness would be diabetes, ongoing asthma therapy, thyroid disorders, and chronic digestive issues. Examples of our acute care services that we provide would be colds, flus, strep throat, mono, minor sports injuries such as sprains and strains. You can see on the right side of the screen that we can provide nebulizer treatments for those students who need breathing treatments. We can provide IV fluids for students who are dehydrated. We also provide wound management, such as suture placement and removal of sutures. And we also have providers who can prescribe Accutane for acne management. Appointments for a majority of the students can be facilitated within a 24-hour period of the time of their call. And we try very hard to provide services to all of our students in a quick and meaningful and timely fashion. Our preventive health clinic has a registered dietitian who provides nutrition counseling and education for students. We also have an allergy clinic where we can provide injections for students receiving allergy immunotherapy. You can see our website or view our website on information on how to submit the student's serum for ongoing therapy for their allergy injections. We also have an immunization clinic where we can provide routine immunizations as well as specialized immunizations. Those specialized immunizations would fall under our travel health clinic, where we can provide counseling and information that is specific to the student's itinerary for their travel health needs. We also have reproductive health services on the third floor. We have our women's clinic, which provides specialized services for our women on campus, and a men's clinic, which provides specialized services for men's health needs. We also have a specific clinic for our LGBTQ students, and that's our gender and sexual health clinic. As you can see, we provide free flu shots, and we will be promoting those free flu clinics in the fall. Typically, we provide those free flu shots in the month of October. We can also provide flu shots if your student misses the free flu clinic at a reduced price at the health center. Our pharmacy can fill prescriptions from health center providers and from outside providers. You can have your student's prescription transferred to our pharmacy. We also have over-the-counter medications that your student can utilize for symptom management. Our pharmacy does take most health insurance plans, so we should be able to help guide your student in terms of their insurance plan and payments as needed. So what happens when your student feels sick? What should they do? They can call the health center and get advice from one of our nursing staff. The staff will help guide the student in terms of home care and potential follow-up as needed, or make recommendations for an appointment at one of our locations. The student can call to make an appointment with one of our patient representatives. They can also go online to our patient portal at our website to schedule an appointment at the time that is convenient for them, and even with a specific provider. And again, most acute care visits can be scheduled within 24 to 48 hours, and urgent care visits will be worked into the schedule. Examples of urgent care visits include asthma exacerbations, students who are actively bleeding, have active nausea and vomiting, or even allergic reactions. We also have after-hours resources. We have an after-hours nurse advice line, and you can see the number there, and that's listed on our website as well. At our website, campushealth.tulane.edu, we also have recommendations for emergency rooms, urgent care centers, and pharmacies if your student needs those services after hours. So in regards to private health information, Campus Health is a HIPAA-covered entity and is unable to share private health information unless we have specific permission from your student, which requires a release of information to speak to you. So you may want to have a conversation with your student in regards to what information they're willing to share and what information they would like for us as providers or the health center to share. So please have the student fill out a release of information if they would like for us to speak to you, their parents. And we actually have one more slide here in regards to required immunizations. I just want to speak about this for one moment. If you go to campushealth.tulane.edu/immunizations, you can download our Tulane Immunization Compliance form. This form must be filled out by your medical provider back home and have that provider complete and sign the form. Students must submit their immunization information through the patient portal using the student's login by July 15th. It's a very important date. We'd like to have all that information in so that we can review that information and make any recommendations as needed. Hopefully all of your students will have their required immunizations and tuberculosis screening questionnaire done and uploaded to our system by July 15th. If immunizations are not in compliance, your student's account will be flagged, and that will block them from future actions to register, drop, or add classes. So please have that information in as soon as possible so that we can facilitate registration for your students during their time here at Tulane. So now I'm going to turn it over to Dr. Scott Timms, and he's going to talk to you about insurances and fees here at the Health Center.
Thanks. So just to let you know, we're about done with our slide set. So if you have questions, you can start typing those in now, so we'll be able to review them and provide answers. So I'm going to talk to you a little bit about insurance and fees, and I will say that our financial policies and insurance and fees pieces are changing. So I would ask that I'm going to give you a sort of high-level discussion about this, but please watch for emails from me in the next couple of weeks, because we're going to be sending you some specific information so that it will be very clear about how our costs for services. So we have a student health and wellness fee that all most degree-seeking full-time undergraduate, graduate, professional students pay. That fee is $320 per semester, and it supports the operations of Campus Health. It allows us to exist. Those cover all of the different outreach services from the health center, CAPS, and the well. It means that we can provide a nurse advice line, the 24/7 line for support, care coordination, referral coordination, all of the services that we're able to provide without a charge. That fee is not health insurance, and it doesn't cover the cost of billable medical services from the health center. Beginning this year, we will, as a service to parents, begin billing your health insurance. So you will be able to make sure that your student has a copy of your insurance when they come to campus. They will provide that to us, and we will collect their copay, co-insurance, or deductible at the time of visit. We will then bill your insurance and accept whatever payment they pay, and then we'll bill you for whatever that remainder of that service is. And again, more information is coming about that, so watch from it as we go. In regards to health insurance, it's very important that you take action to make sure that your student is adequately covered. Every degree-seeking Tulane student is required to have health insurance coverage that meets our requirements. Degree-seeking students must take an online action to either waive or enroll in the Tulane-sponsored Student Health Insurance Plan, or TShirt. If you do not take, or if your student does not submit proof of comparable insurance, they are automatically enrolled in our sponsored plan, the TShirt. The enrollment/waiver period is July 5th through September 8th. Your students will begin getting emails next week telling them to submit their information to make sure that your insurance is there. I'm a nice guy, and I send an email to the parents to remind you to make sure that your student checks that out. So you want to make sure that you check that email and make sure that your student takes action to submit the waiver. Every year, come October, November, and December, I have parents calling and say, oh, my student didn't waive out of the insurance and we were auto-enrolled. Can you fix it? I can't do that. If you're enrolled in that, then that means you had insurance coverage for those months and you have to pay for it. And you were automatically charged. So please make sure that you take care of the insurance waiver process. This is something that you will do every academic year while your student is at Tulane. If you have questions about that, you could, what the insurance requirements are, the waiver process, please go to our website. All of the waiver and health insurance information is available for you there. The Tulane-sponsored Student Health Insurance Plan, or TShirt, is provided is a United Healthcare product. It's called United Healthcare Student Resources. This meets all of our requirements. It offers a low copay for prescriptions in our pharmacy, and any service at the health center is covered at 100%. It is a great plan for a student who is coming to a city where their insurance back home does not provide the adequate coverage here. It covers pre-existing conditions, mental health services. It has an unlimited annual maximum benefit. And again, it works when they're here and when they go back home to visit you or other family members across the country. So it works and is a good plan. It was designed specifically for the types of needs that we see in our students. If you have questions about that plan, information and the brochure is available on our website. So I really recommend this plan. I will say, this is a plan that we promote because it's a good plan. We don't get paid a kickback if you sign up for it, so there's no benefit for you to take it beyond the fact that it provides your student good healthcare coverage while they're in New Orleans and when they're at home. It isn't something that you're not auto-enrolled in it just to help us make money. This is a good healthcare plan, and we really believe in what this plan provides and offers. Your insurance, in order to waive out of the TShirt plan, means that you have to have the following requirements: unlimited annual maximum benefit, emergency and urgent care in New Orleans, non-emergency care in the New Orleans area, and your student must be covered the entire academic year. This is all available online. One of the issues that parents run into most often is about non-emergency care in the New Orleans area. So what that means is oftentimes your insurance will say, well, they've got emergency care at school, that's all they really need. Emergency care means that I break my leg and I go to the emergency room and I get taken care of, and that's great. But then I find out I need physical therapy. That's not emergency anymore. That's non-emergency care here, and oftentimes we see insurance plans refuse to cover that. So really making sure that you have that non-emergency care resource here is very, very important. The TShirt website looks like this. You can go and check it out. There's a benefits comparison. All of the information that you need is available there. So please look into the insurance to make sure that you've got adequate coverage, whether that be the plan you have now or another plan that you choose. And we will are always happy in our insurance office to talk to you about insurance and what we think would be best for your student based on your needs. Our new student checklist, so just a couple of things to make sure that you do: submit your immunization compliance information through the patient portal by July 15th. Review your health insurance and take action to waiver enroll, and again that opens July 5th. Very important to take that action. Our online education courses will be offered beginning in a couple of weeks as well, and those have to be completed by August 24th. We offer an online program, require students to complete Alcohol Wise, Consent and Respect, and Cognito at Risk. These are programs that your students will need to do in order to be prepared for their time here at Tulane. We also recommend that you take those courses as well. These are great ways for you to begin having conversations about alcohol, consent, and our at-risk program, which focuses on mental health response and referral. So making sure that you've seen those as well can really help your student be successful here. Our immunization compliance, Dr. Garrett already talked to you about. Again, make sure that you've submitted that paperwork. Again, if you go to our website, you'll be able to see all of the requirements, which are state laws that we collect this information. So please go check it out, upload our form with whatever documentation your provider may give you. And then our campus maps are here as well. As you can see, the health center, CAPS, and the welfare health promotion are located on the Uptown campus. We also have a downtown location for the health center and CAPS to provide services to our graduate professional students, but your students will primarily be on the Uptown campus. We have a variety of social media platforms where you can connect with us, so check those out if you're on Facebook, Twitter, Instagram, or YouTube. We have some funny videos that are made by our students. And then these are our contact and phone numbers. So all of the resources that we've talked to you about today, you can call, you can ask questions. Our pharmacy number is here so that you can transfer. So we appreciate your time. I'm going to turn it back over to Penny Wyatt, and we'll be happy to take your questions.
Okay, everybody. You've just heard a lot of information, so you might not have any questions or many, but we're happy to consider those, so please type those in. Give us just a second. So one question is, my student will be a minor until Thanksgiving. So does she need to sign medical information release form now, and where would that be available if that's required? So dealing with a parent who has a student who's under 18 until Thanksgiving.
So our recommendation, there are two issues here. Any student who's less than 18 in Louisiana has to sign a consent for treatment, which is a form that they can call. You can call and talk to one of our nurses, and we can describe to you what we'll need. We don't recommend a blanket consent form for any of our services. Once we have a consent to treat, we will work with the student to make sure that they talk with you, but we prefer to do consents to share information with you at the time of treatment. Again, what I would recommend to discuss that case when you have a student who's going to be a minor when they arrive is to call and talk to one of the nursing staff. They can really explain how that works for you.
Okay. So a few parents have said that they think their students would be interested in some of the groups, and they wanted to know if there's a charge to join, and how does a student join?
There is no charge to join any of the groups at CAPS. All of CAPS services are covered under the Student Health Center fee that Scott Timms referenced. And what was the other part of the question?
How do they join?
So all they need to do is call the main number that's listed on the contact page, and either ask for a consultation if they think they're interested in more than one service, or if they know they just want to go to a group. If they request to speak to the group coordinator or reference the group coordinator will get in touch with them and kind of make sure timing and fit kind of makes sense before scheduling an appointment, so they can kind of see in person as well if the group still sounds up their alley.
Okay, the next question is, can we have our doctor for type 1 diabetes insulin and test strips and prescriptions directly to the Uptown Campus Health Center pharmacy since they're required every month?
This is Dr. Garrett, and yes, you may have your provider from your hometown or from your current provider send those prescriptions into our pharmacy. We will honor those prescriptions. Your student can bring them in paper form, or they can be called in by your provider or staff at your provider's office. So we're more than happy to honor those.
And so if they were going to be called in by the physician, do they use this phone number on the screen for the Uptown Health Center?
They would use the number for the pharmacy.
For the pharmacy. Okay, great. The next question is, my insurance plan has different charges for in and out of network providers. How do I know if the services at the health center are considered in network or out of network for my plan, or is it always an out of network charge?
Great question, and we'll be providing more information about this as we go forward. But at this point, as this is a new service that we're offering, we are not in network for any health insurance plan. So we would always be billing as an out-of-network provider. We are in the process of negotiating with the top 10 companies that students typically come with. So we hope by the spring to have some managed care agreements in place. But at this point, we will always be billing as an out-of-network provider. With that said, our fees are still lower than an out-of-network provider in the community. So we probably will still be the best option. But we're happy to talk with you when you get ready to come and talk. We'll describe costs and services.
So the next question is, what is the cost of the TShirt coverage?
Sure. The student health insurance plan, the TShirt coverage it's about $1,250 per semester, about $2,500 to $2,600 per year. And again, we typically enroll students for a full academic year, and that does cover the summer. Sometimes students are in a transition period and they maybe only need it for one semester or the other, so we will work with students to make sure that they have the coverage for the time period that they need.
Is it billed per semester?
It is billed per semester.
Okay. So the next question was about the allergies. If Claritin works for a parent's student in Chicago, do you think it would work in New Orleans? So what's your assessment of that?
So yes, Claritin would be a fine medication to use. Please note that we have a different flora here in New Orleans, and we have less of a winter time than the students from the north part of the country. So students tend to have more allergy issues throughout the year than they might have back home. So I would encourage your student to be proactive in their assessment and treatment of their allergies, and be proactive. If they need additional assistance, they're more than happy to come to the health center and talk to one of our providers for further recommendations and possible management of those allergies.
So the next question is, while primary care is offered at the health center, do we need a specialist like an endocrinologist off campus? So can you talk about those kind of specialist referrals and that stuff?
Sure. So depending on the student's needs, we can manage a great deal of clinical conditions here at the health center. If we feel your student needs additional resources or additional services above and beyond our capabilities, we have a referral coordinator who will help the student find a specialist within the community to provide that ongoing care and those ongoing resources. So we're more than happy to help manage the student's condition, and we're also more than happy to refer that student to an off-campus specialist as needed.
And I will say that I've often seen that parents start talking to each other about specialists, and there are people who live all over the country, and I always have to remind them that we have staff here who will do that. And so I would really urge you parents to rely on our staff here. They've got, connections, and they know these different people that they're referring to, and they understand what a Tulane student's challenges are in terms of transportation and things like that, so they know to help them find people that are good providers but are also accessible. So I just think that that's a great service that's provided that I think parents don't take advantage of enough.
And one more caveat that I would add to that is, if your student has a chronic medical condition, have your student come to the health center within the first couple of weeks of classes so that we can take a full history, do a physical exam, make sure that the information is in the chart, in their records, so that in case there's an exacerbation of that chronic medical condition, we have that information on hand and we can address the situation as needed at that time.
So the next question is, would parents be contacted in a serious emergency, even if the student had not signed a consent and is not able to give consent due to the illness or injury?
Hi, Penny. Yes. So in times of dire crisis, we have the ability to contact next of kin or emergency contacts for that purpose. This question comes up a lot. I actually had a parent ask me a few weeks ago, if my child's in a coma, they can't sign a release, what can we do? We're going to call you. Again, we look as parents, as partners, and if you're the emergency contact and that primary resource for that student, we are going to reach out to make sure that you're informed. We have a variety of support services on campus through Student Affairs, our case management office. Oftentimes when a student's in crisis and has gone to the hospital for some reason, we actually have case management staff who will go to the hospital if necessary, and they'll be in contact and sort of play a liaison role between the hospital and you in those cases of emergency. So we always are able to work with parents in those types of emergencies. And I also just want to add, I did look up the exact premium rates for SHIP. It's $1,689 per semester, or $2,674 for the entire year. If you look at our website, you can actually get a comparison about exactly deductibles, copays, and in and out of network services for that. So thanks.
And I'll just add one thing about the emergency situation, because I had a conversation with a mom about this a couple of years ago, and her student had gotten hurt, playing sports on one of the fields, and had an older brother who happened to be here, and his older brother took him to the emergency room, but they didn't engage anyone at Tulane, so we didn't know anything had happened. So I do think that it's important that your student, even if they handle something on their own, they let their RA know that something happened, or it's really best from campus to call our TUPD office, our Tulane University Police Department. They'll dispatch either our Tulane EMS service or one of the city ambulance services if they need to be taken to the hospital, but that starts a record here at Tulane that then we can track and then follow up with that student. So I think that that's just really important to know. So remind your student to make sure somebody at Tulane knows if an emergency or something like that out of the blue came up. So it looks like that's all our questions. So I'll make a last call for questions. One other question is, which local pharmacies deliver to Tulane?
If you go to the especially for section of our website, there are several that will deliver to campus. Check it out there. We also list the local urgent cares that we recommend. But there are 2 that I believe that are currently delivering to campus that are relatively close. But they're contacted, the phone numbers, fax numbers, all that information is on the website under the especially for piece.
And those are sort of smaller local pharmacies. They're not part of the big chain.
Correct. They are smaller local pharmacies there. And again, our pharmacy on campus, which is open Monday through Friday, 8:30 to 5, and Saturdays 9 to 1, doesn't deliver to the residence halls, but it is right on campus in the health center, and it bills almost about 95% of the insurances that our students come with.
Okay. So parents, any other questions? Where do we have delivered durable medical supplies? Would they send those just through their regular campus mail address or to the health center?
So most durable medical supplies can be delivered to the students' on-campus address, and they will be able to access or obtain those devices through the Tulane Postal Service or post office. If a student has medications, they can also have those shipped to their address here on campus. We also will take, again, allergy immunotherapy can be shipped to our location here at the health center. And again, you can go to the website and review that information on our website in regards to how to have that medication sent to us. But most of the time, students can receive their prescriptions or medical supplies through the mail.
And students will receive their mailing addresses later in the summer after their room assignments are made. Their residence hall and room numbers will be coming to them in July, and then shortly after that they'll also get their mailbox number, and that is different from their room number and building. So they have a centralized mail room where they have mailboxes, but then it also has an office there where larger packages are delivered and held for students. And when they come in, they send them an email to let them know they've got a package to pick up if it doesn't fit in their mailbox. And then they can show their information and send that. So another question is, can we add an extra fridge in the room for medical supplies? So there is already a micro fridge in every single room that's supplied. You might have to make a request for that directly to the housing office. And so you can email housinginfo@tulane.edu, and it's possible that you would have to submit something to our Goldman Office of Student Accessibility to kind of get the support for that being an accommodation that needs to be made. But I would say start with the housing office and see what they say. And does that seem right? And then, so do you have something to add about that?
Yeah, one caveat that I would add is if your student is on a ADD, ADHD medication or other chronic medical or other medications for chronic needs, I would encourage your student to have a lockbox in their room so that they can keep not only their personal items but those prescriptions and medications locked away, just for their own safekeeping and for the student's benefit.
Okay, so I think that's all of our questions. So I'll just ask that you look in your emails tomorrow, and I'll send you the slides and the link to the webinar, and then next week it'll be on our website. But I'd also ask if you have feedback. We appreciate getting your comments and suggestions. So you can either type in something now or send us an email, and that would be sent to parents@tulane.edu. So our next webinar will be July 12th, and that one will be on emergency response planning. So please tune into that one. You can register on the website, and I'll send you that registration information when I send you the follow-up email. So we appreciate your comments, and we appreciate your interest in the webinar. Thank you so much. So we will close now. Thank you. Good night.